Hi there, my name is Mike Pishvaian. I'm an associate professor at Johns Hopkins University, and it's my pleasure today to talk about the relevant updates in GI cancer from ASCO 2023, incorporating some of the data that we've also seen throughout the year. I'm going to talk a little bit about some of the targeted therapies and some of the more practical aspects of caring for patients with GI cancers that have come up in the last roughly 12 months. We know that immunotherapy has made a major impact on the treatment of gastroesophageal cancers. Starting back from Checkmate 649, when Dr. Janjigian first presented in 2021 that nivolumab improves overall survival when added to first-line CAPOX or FOLFOX for metastatic gastric cancer, that was really when it became established that we use nivolumab consistently for patients with upper GI cancers in the metastatic setting. In this study, in that original study, CPS score was not a determining factor for enrollment, but it did appear later that the benefit was greatest for the addition of nivolumab in patients with CPS greater than or equal to 5 tumors. And this is still actually a hot point of debate as to whether you should only use it in those patients or, as the study was designed, whether you can use it for any patient irrespective of the CPS score. But nevertheless, as the study was designed, there was an improvement in median overall survival with the addition of nivolumab up to 14.4 months compared to only 11.1 months with placebo. A short time after that, we also saw the publication and the presentation of 5-FU platinum trastuzumab and pembrolizumab for HER2-positive esophagogastric cancers. And this was remarkable because the objective response rate was 91%. And you can see these amazing waterfall plots in the study that was presented. There is a confirmatory phase 3 trial called Keynote 811 that's completed accrual, but has not yet been presented to my knowledge. And then Checkmate 577 taught us that using adjuvant nivolumab for patients who met a very specific criteria. It was patients with resected or esophageal or gastroesophageal junction cancers who had received chemoradiation in the neoadjuvant setting, and then after surgery had residual pathological disease. So patients who had a complete pathologic response were actually not eligible for this study to a great degree because those patients have such a good prognosis that it wouldn't be clear if any additional therapy such as nivolumab would help. So Dr. Kelly published this in 2021. And the median disease-free survival in this resected population was significantly longer with the addition of nivolumab, 22.4 months compared to only 11 months with placebo. So in many ways, this really firmly established the role of immunotherapy and nivolumab to a great degree in the treatment of esophageal, gastroesophageal junction, and gastric cancers. So coming into ASCO 2023, that begged the question, what about postoperative therapy for gastric cancer specifically? Because Dr. Kelly's study only allowed for esophageal and gastroesophageal junctional cancers. The ATTRACTION-5 study was presented at ASCO 2023, and it was a phase 3 study of nivolumab plus chemotherapy as postoperative adjuvant treatment for pathological stage 3 gastric or gastroesophageal junction cancer. Dr. Terashima presented this. And actually, surprisingly, the study was not a positive study. It was a negative study. So again, it was a phase 3 double-blind placebo-controlled study. It was exclusively an Asian population, Japan, Korea, Taiwan, and China. And because of that, patients could be treated with either CAPOX or S1 as they often will do in the Asian countries. And then for the patients, either nivolumab or placebo was added to the chemotherapy backbone, and the primary endpoint was relapse-free survival as determined by independent review. And what you can see both in the relapse-free survival and in the overall survival curves at 3 years, there was actually no statistically significant improvement in the relapse-free survival, the 3-year relapse-free survival, the median overall survival, or the 3-year overall survival. So based on this study, there's currently no role for adjuvant nivolumab for resected gastric cancer, despite the very positive data for resected esophageal and gastroesophageal junctional cancers. One permutation of this to highlight was the perioperative study as the addition of an immune checkpoint inhibitor. So in this study, which was actually just a relatively small randomized phase 2 study, chemotherapy was used for patients preoperatively and then postoperatively. And the immune checkpoint inhibitor Toripalimab was added for in one group of patients. And you can see here, the randomization was 1-to-1. Patients received SOX or Zelox, went on to have surgery, and then went on to receive 3 additional cycles of SOX or Zelox. And in the experimental group, Toripalimab was added both preoperatively and postoperatively. In this study, looking really at the surgical and pathological endpoints, there was clearly an improvement in the tumor response grade, and there were more patients who had a TRG 0, otherwise a pathological complete response, for those who received the Toripalimab, and a combined score of TRG 0 or 1, which is either a pathological complete response or an excellent response. There was also statistically significant improvement. What we don't know is that will this translate to any actual survival benefit? And there were actually several other studies at ASCO and ASCO GI in 2023 that really started to call into question whether whether we're making too much of a leap of faith that pathological complete response really translates to overall survival. So the outcomes of this study ultimately, in terms of survival, will be really critical to follow in the near future.